Hello, this is Dr. Jones with Inspire Dental, and today I want to talk about general dentistry and preventive care. So a very common question that we get is, well, how often do I visit the dentist for just regular checkups? The minimum that we like to see is every 6 months. The reason every 6 months became what was recommended is because in a traditionally healthy dental patient, when we do a cleaning, it takes about 6 months for the bacteria in your mouth to fully populate to its full extent the way it was before you got your cleaning. So that's why 6 months became the normal recommendation, because that helps us keep the bacteria under control, which means it helps us prevent and keep disease under control. Now, one of the things that we offer in our practice to help just remineralize and strengthen your teeth are something that's called hydroxyapatite and fluoride. So most of us know about fluoride treatments because that's been in dentistry for a long time. And fluoride has been shown to help remineralize the teeth and make the teeth more acid resistant to either disease or decay. The reason I mention acid is because a lot of us think that sugar is what causes cavities. It's actually the bacteria in our mouth. We all have bacteria in our mouth, and the bacteria in our mouth eats what we eat, and it just happens to eat sugar. When it eats the sugar, it makes acid. And when it makes acid, that acid is what decays and rots our teeth. So fluoride helps make the teeth more acid resistant. Hydroxyapatite, like I mentioned, is another thing that we use, and that's actually what the teeth are made of. Our enamel of our tooth, that outer surface of our tooth, is made of a hydroxyapatite. And so what's cool is we have that mineral available to us nowadays that we can help introduce that to the teeth, and that actually can help remineralize the teeth as well, strengthen them to be resistant from breaking down. So one of the best ways to prevent our teeth from decay is our normal home routine of hygiene and also diet. Now, none of us like to be on a diet. So, and I understand that. I myself don't like it to be on a diet. I like all those candies and drinks that are just not good for you. But everything is done in moderation. And it's also how you care for your teeth after you've had those things. So, example for me, I enjoy sour candies and sour snacks, or chips and sodas. But immediately when I'm done consuming those things, I rinse my mouth out. So I don't necessarily brush my teeth, because you can actually brush in those acids. But I'll at least rinse my mouth out or chew some gum. That way, what that does is it neutralizes the acid in my mouth so that it's not sitting on my teeth for a long amount of time. So those are some ways to prevent. Another way is, like I was talking about earlier, is through fluoride and hydroxyapatite. So we have lots of mouth rinses and toothpaste nowadays that have that in it. And so what's nice is that you don't have to just rely on getting it when you're at the dentist, but when you go home, we can prescribe you a toothpaste that has those contents in it, and that you can use at home. And that way, as you are cleaning your teeth each and every day, you're helping repair and strengthen your teeth. So it's very common that once a year when you come in for your dentist appointment, we're going to take x-rays. We take these x-rays just as a screening to make sure that we don't see anything developing. Or if there is something developing, we catch it early. Now, a question we often get asked is like, well, are they safe? Because people are afraid of being exposed to excessive radiation. So now with the advance in dental technology, that radiation dose is getting lower and lower and lower. And so everything that we use in our office is digital. And the digital x-rays have been shown to have the least amount of radiation. It's like a minuscule amount compared to what was before in dentistry. And so you get more radiation from being out in the sun than you would even from taking a couple of x-rays in the office. And that's one of the things that we look at for our patients. We want our patients to be safe. We want our patients to get healthy, but not at the expense of something else. And so that's why we provide the latest technology and the lowest type of radiation. And so when you're at home taking care of your health, flossing is going to be a very important fact. What flossing does is it helps prevent gum disease, helps get things from in between your teeth out. So it also helps prevent tooth decay. One of the biggest ways that we stay on top of gum disease is by making sure we get our routine cleanings. Because when we do your cleanings, we're cleaning any bacteria, any plaque, any tartar off of the teeth. Plaque and tartar are the starts of what cause gum disease, and we can tell that we are beginning to get some gum disease when our gums bleed. So that's why it's so important that we make sure you stay on top of it, because if you start to see bleeding, that means gum disease is beginning to form. So I hope this video of preventive care was informative and helpful for you. Best thing to do is call our office to set an appointment for your routine cleaning and exam. Our office number is 210-734-5092. You can also request an appointment on our website and also gain more information on preventative care at inspiredentalsa.com. Thank you for your attention. Look forward to seeing you soon.